Name the two distinct processes of the temporal bone. 1. Mastoid process. 2. Styloid process. What is the bony opening for the external ear? The external auditory meatus. Where do the majority of the muscles of facial expression attach from and to? Originate on facial bones and insert into the skin, connective tissue of the face. What nerve innervates the majority of muscles of facial expression? Facial nerve, CN7. What muscles of facial expression are innervated by the trigeminal nerve, CNV? 1. Masseter. 2. Temporalis. What muscle forms part of the lateral wall of the oral cavity? The buccinator muscle. What fossa covers the masseter and parotid gland? Deep cervical fossa, parotid fossa. How many muscles of facial expression are there? 17. Name the muscles associated with the scalp and eyebrow region. 1. Frontalis. 2. Corrugator supercilii. Name the muscle associated with the neck region, flaring upwards to the face. Platysma. Name the muscles associated with the nasal region. 1. PROCERUS. 2. NASALIS. 3. LEVATOR LABII SUPERIORIS ALAEQUE NASI. Name the muscles associated with chin region. 1. DEPRESSOR ANGULI ORIS. 2. DEPRESSOR LABII INFERIORIS. 3. MENTALIS. Name the important muscle that helps to control the cheeks movement. Buccinator. Name the circular muscle around the orbital region. Orbicularis oculi. Name the 5 main branches of the facial nerve. 1. Temporal. 2. Zygomatic. 3. Buccal. 4. Marginal mandibular. 5. Cervical. Name the posterior branch of the facial nerve. Posterior auricular. Name the muscles of facial expression that are innervated by the temporal branch of the facial nerve. 1. Frontalis. 2. Orbicularis oculi. Name the muscles of facial expression that are innervated by the zygomatic branch of the facial nerve. Orbicularis oculi. Name the muscles of facial expression that are innervated by the cervical branch of the facial nerve. 1. Platysma. Name the main branches of the facial artery. 1. Submental. 2. Inferior labial. 3. Superior labial. 4. Lateral nasal. What vein does the facial vein drain towards? Internal jugular vein. What branch of the retromandibular vein unites with the facial vein? The anterior branch. How is the external jugular vein formed? Through the uniting of the posterior auricular vein and the posterior branch of the retromandibular vein. What arteries of the scalp branch from the ECA? 1. Superficial temporal. 2. Posterior auricular. 3. Occipital. What arteries of the scalp branch from the ICA? 1. Supratrochlear. 2. Supraorbital. What type of superficial veins drain the scalp? Emissary veins. What do the emissary veins communicate with? What complication can this lead to? The dural venous sinuses, possible route for infection. Name the 3 divisions of the trigeminal nerve. 1. Ophthalmic, sensory. 2. Maxillary, sensory. 3. Mandibular, sensory and motor. Name the facial branches of the ophthalmic nerve. 1. Frontal. 2. NASOCILIARY. Name the facial branches of the ophthalmic nerve. 1. Frontal. 2. NASOCILIARY. Name the facial branches of the mandibular nerve. 1. Lingual. 2. Inferior alveolar. 3. Auriculotemporal. What is the action of the frontalis? Elevates the eyebrows and wrinkles the skin on the forehead, protracts the scalp. What is the action of the corrugator supercilii? Draws eyebrow medially and inferiorly, creating vertical wrinkles above the nose. What is the action of the platysma? Depresses mandible, against resistance, tenses skin of inferior face and neck. What is the action of the procerus? Depresses medial end of eyebrow, wrinkles skin over the dorsum of the nose. What is the action of the NASALIS? Works with procerus and LEVATOR LABII SUPERIORIS ALAEQUE NASI. What is the function of BUCCINATOR? Presses cheek against the molar teeth, works with the tongue to keep food between the occlusal surface and out of the oral vestibule. What is the function of orbicularis oculi? Closes eyelids, palpebral part does so gently, orbital part tightly, winking. What is the function of zygomaticus major, dilator of mouth? Elevate labial commissure, bilaterally to smile, and unilaterally to sneer. What is the function of zygomaticus minor, dilator of mouth? Retract, elevate, and/or evert the upper lip, deepen nasolabial sulcus, showing sadness. What is the function of orbicularis oris? Tonus closure, oral fissure, phasic contraction, compression, and protrudes lips, kissing, or resists distension, when blowing. What is the function of LEVATOR LABII SUPERIORIS? Does the same action as zygomaticus minor. What is the function of LEVATOR ANGULI SUPERIORIS, dilator of mouth? Widens oral fissure, as when grinning. What is the function of risorius, dilator of mouth? Depresses labial commissure bilaterally to frown. What is the function of LEVATOR LABII SUPERIORIS ALAEQUE NASI? Depresses allolaterally, dilating anterior nasal aperture, flaring nostrils. What is the function of depressor anguli oris? Does the same action as risorius. What is the function of depressor LABII INFERIORIS, dilator of mouth? Retracts, depresses, and/or everts lower lip. What is the function of MENTALIS? Elevates and protrudes lower lip, elevates the skin of the chin.